I'm Jennifer Martin, host of Franklin County Home Health Agency's Where the Heart Is. Franklin County Home Health Agency is a nonprofit home care organization that has been providing services to people of all ages throughout our county since 1969. While its programs and services have grown dramatically since its beginning, its commitment to our community remains as strong as ever. We are proud to bring you this show dedicated to sharing information about the agency's programs and services, as well as offering helpful wellness tips to help you stay safe and healthy at home. I'm very pleased today to have two leaders from Franklin County Home Health Agency with me. Janet McCarthy is the Executive Director. Hi, Janet.
Good morning.
And Gina Clark is our Chair of the Board of Directors. So thank you both for being here. So somehow it's September already. I don't know how we got here, but it is September, the air is changing, and what happens every September at Franklin County Home Health Agency is our Board of Directors holds its annual meeting, and you invite our staff and community. So let's talk a little bit about the annual meeting and what you celebrate there every year.
Well, the annual meeting always marks an important time. It's a transition of our leadership where we recognize outgoing board members, and this year Michel Consejo is completing his third-year term with our organization. He's been a wonderful supporter and we will really miss him. We'll also be welcoming 4 new board members in. Another major thing that we do each year is recognize a member of our community who has demonstrated tremendous community service. We've named an award after Reverend Orrin Lane, and we're looking forward to making that presentation. We also recognize our staff and volunteer involvement. We have provide 2 Make a Difference awards, and we're also looking forward to recognizing our staff and volunteer contributions.
Can you talk about the uniqueness of the Make a Difference Award, how that's awarded at the agency?
Yes, well, so often we work with wonderful people, and the Make a Difference Award, actually, individuals are nominated from our own staff. So it's staff peer recognition, really a wonderful way to recognize and acknowledge and thank our coworkers.
Yep, that's a unique way to do it. It's so important to get that recognition from peer support.
Absolutely.
And understand that. Talking of your staff, you also do staff milestones, is that correct?
We do. We recognize our staff's contributions to our organizations, and we have many staff that have worked for our organization through the years, and so we, in 5-mile increments, take time to acknowledge that and really celebrate that. Mm-hmm. So we have, this year, 32 employees have received their milestone awards. It's their accumulated years is 375 years. So it's really a lot of talent, experience, and dedication to our organization. We have 3 members who are receiving their 25-year pins this year. 2 nursing assistants, Brenda Marcoux and Mary Ellen Sanders, and Kathy Marn, who is our rehab manager. And we actually took some time earlier in the summer to acknowledge their contributions, and I always think Mary Ellen said it so nicely. She said, I always knew I wanted to work for home health, and I knew I would get my 25-year pin.
That really speaks to the loyalty that people have for the agency.
It certainly does.
How about yourself, Janet? How long have you been with home health?
I've been here 23 years.
Wow.
Doesn't seem possible.
Yeah. And yourself, Gina, how long have you been affiliated as a board member?
This is the end of my 3rd year, and I'm starting my 4th.
Good.
So
it's good to have you here. Talk about, so you've covered the annual meeting. What is the date of the annual meeting? So I think this is going to air during that time.
Yeah, our annual meeting will be September 19th. So look for press releases after to find out who the recipients of the awards are.
Sure, right. Our Community Service Award is a secret right now,
That's
but
right.
we'll look forward to that, seeing that in the papers. And talk about our board members, Gina. As a board member, how did you come on board, and what have you learned in your leadership role here at Home Health?
I got involved with home health because I had some time earlier in my life. My family received services from home health, so I wanted to give back, and it was just a good time to get involved. So I'm amazed at all the things that home health does. My experience with home health was with the elderly or somebody that was terminally ill. So as a board member, I've learned about all the other things that they do, and I've had the pleasure of a tour. I got to go, like other board members have, to tour with the nurses and the speech therapist, and to go out for a day. And I spent the day traveling with children and seeing children that are receiving the services with home health. So that was a lot of fun. One of the houses that I visited was with an autistic child, and they were also doing physical and speech therapy. They had 2 individuals come in while I was visiting. So that was, of course I love children, so it was fun to do that. The other child that we visited was in a wheelchair. I think she was 5, and she was learning how to use braces, and the nurse was assisting her in adjusting them, and I'm not a nurse, but so I got to witness firsthand some of the things that she was doing. Janet could probably speak better to, all the nursing aspects of it, but
A lot of the children are through those therapy programs that you mentioned, speech therapy and physical therapy and occupational therapy. It might have been an occupational therapy, helping children or adults learn those basic skills if they need adaptations.
It was a kind of a happy situation. It was kind of fun, and so the little girl put on her braces and, walked over to her Susie Bake oven and made me a pretend smoothie, and it was fun. It was like play, but they were also getting some therapy,
and isn't that how kids play? Their work is play, so our therapists are skilled in that, making them happy.
It was so much fun to go and see what they were doing and how they served the community with children. And so it was a little happier aspect of home health.
I'm glad you shared that. It is. We talk a lot about serving people of all ages and from all different circumstances. So like you said, there are some sad stories, but there's always a ray of hope, say for in hospice and stuff, that we bring happiness to people because you're helping people stay well at home, and that's our goal.
We receive services with home health for hospice for my in-laws, and we were able to keep them at home. So one of the ways to give back to home health is by serving as a board member or donations, and so this was an avenue at this time that I chose to do. But it's a lot of fun. We do fun things like the Blue Jean Ball.
Yeah, we'll talk about that in a little while later too. Thank you, Gina. We're glad to have you on the board. You're talking about programs and our services, so Janet, if you can expand a little on home health in Franklin County. Let's go way back. Why was there a need for it in the past, and we started in 1969, and how it grew and what changes you've seen in your 23 years?
Well, before 1969, most of the towns in our county actually hired a nurse, and that nurse would sort of check on people after they were in the hospital. They might go and give some kind of an injection, or they might help someone with a bath. But in 1969, the home health agencies started to become more prevalent across the country as a result of the introduction of the Medicare insurance benefit for individuals that were over the age of 65. And there were 2 nurses in our community, Cynthia Rugg and Norma Walgrove, who learned about this new thing called Medicare. They were working in the hospitals, and they recognized that many people still had ongoing care needs after they left the hospital. So they were very, very involved at a grassroots level to do some fundraising, to create and complete the application process, and they were really instrumental in us starting. So we've started in 1969 with a very, very small staff. I think the executive director was the nurse, the director, the biller, and probably emptied the trash on Friday nights as well. Sure. We've grown now to a staff of 220. We've added programs through the years to meet our community's needs, primarily in a community setting. We were one of the first hospices in the state of Vermont to become certified. We were part of a demonstration project in the mid-1970s, and we're very proud of that, and we were actually recognized in the legislature last year for that work. So we continue to look and grow our services. We have a very large long-term care program for those individuals who want to stay at home and age in place, and we continue to look for opportunities to expand those services and really help people stay as independent as they can in their community.
I wonder if this is where we should give a little kudos to the individuals that during Irene and other things, how they were able to reach individuals in our community.
Sounds good.
I only heard a little bit at the board level, but we've have staff members that have taken snowmobiles and rowboats to reach people in their homes. I think
kind of like the mail service. We'll get there.
Yeah, I'm quite impressed. That's dedication and ingenuity, I think, to come up with how am I going to get there, above and beyond. So I'm very thankful that we have staff that serves our community in that way.
We do provide services 365 days a year, and we figure out how to reach people during challenging times. And we certainly in the last year have experienced the ice, the snow, and lots of flooding and water.
And we are in Franklin County, so we have to go to all nooks and crannies so our nurses make it, and our therapists, sure. Good. Talk about some of the newest programs that you've implemented that you're excited about. We've talked about a little bit about one of them here on a past show, but
yes. Well, I'll start with that one just as a refresher for those who watched and those maybe who want to go back and watch it. But the Nurse Family Partnership is a nationally known program which serves low-income first-time mothers. It's an evidence-based program, which means that there's been a lot of research about the techniques and tools that are used in that program to help women and families have healthy pregnancies and have successful outcomes. So we are very, very excited. There were 2 home health agencies in the state of Vermont that were selected to begin that process, and so we've been working over the last year to get that up and running. We're fully staffed, and I think as of right now we have 9 clients enrolled in that program. So we're right on track and very excited to bring this fresh new program to support our young families in our community. On the other end of the spectrum, we're also very involved in starting to work with a new project in our community called SASH. SASH stands for Senior Assisted Supported Housing, and it's a part of a demonstration project provided with Medicare funding, which again provides some additional support services for people over the age of 65 in our community. And there are a number of projects that have started up, and we are involved with providing the wellness nursing piece of that, which means we do everything from checking blood pressures to checking on people after they come home from the hospital, assisting people with medication management, and supporting the staff in those housing units. So we're pretty excited about that. We've also been very involved in the Blueprint for Health in our community. And Blueprint for Health is a statewide initiative which is designed to support medical homes and primary care practices in our community, and we've been involved with the planning and implementation of some of those projects, and that's a major part of healthcare reform, so we're really excited to be included in that.
You're part of this team that's helping,
that's
like you said, helping each other in the community, but also setting out a blueprint for the future and as we move forward. It's exciting stuff. Thank you.
It is.
Yeah.
Well, some of the stuff that you do, Gina, is not just with paid staff that go into the homes to visit. My family receives some of the services with someone just coming in and sitting.
Yep. The volunteer services that we provide through our hospice program are really fundamental and instrumental in the care that we provide. And we also have our wonderful board of directors who volunteer their time and talents. So I think combined we have a volunteer staff of about 60 people.
And not to mention staff or community members who volunteer at special events or to help get other things done throughout the year. So
that's right.
Can't do it without that people power. Good.
Some
and
of
the
the
hospice volunteers, I'm sorry, just really quick, training happens. What are we doing this year for hospice volunteer training? Do you?
I'm embarrassed to say I don't have the exact date, but we do have volunteer training.
It's on the website.
Coming up. And
on the 7th.
Good point. Just check out our website, fchha.org, and we'll have information about that. So just
or give us a call.
People knew we did the intensive training for that. Sure.
And not all of the volunteers are for hospice.
Right.
Right. So if you're not comfortable being a hospice volunteer, there's other ways to volunteer to go into people's homes.
But the training does help people prepare for that unique experience of a hospice volunteering, and it's also there. Just you want to volunteer, but we all could use that knowledge. So it's a wonderful program that you offered for the training and that. So other programs that, or you mentioned evidence-based with the Nurse Family Partnership, and when you talk about that, if you don't want to recreate the wheel, you want to do what you know is working well. How do you measure your other programs? How do you know their outcomes are working well? techniques do you use?
Yeah, well, I think one of the benefits of being a Medicare certified home health and hospice organization is that we do provide data to CMS, and we get reports back about how our performance compares to others. One of the things that we're implementing right now in our home care program is a chronic disease management program. And this is also evidence-based. It standardizes care so that we can assure that all of our patients with certain chronic illnesses, specifically heart failure, COPD, pneumonia, diabetes, and depression, receive the same kinds of comprehensive care. All the plans of care are tailored to that individual patient, but we want to make sure that we get all the essential elements in. One of the major components of that is self-management and helping people to learn how to care for themselves to prevent hospitalizations, unavoidable, avoidable emergency department uses. So we measure our success in a variety of ways. We know what our hospitalization rate is, which our patients we've really reduced that over the last 5 years. We know what our emergency department rate is. We know how many patients fall and that sort of thing. And we measure patient satisfaction. We take that very seriously.
So what does CMS stand for?
Oh, good question.
Because
So
they do this to me all the time at the board meetings. Sure. It's like, okay, I don't know the lingo.
Yeah, so CMS stands for the Centers for Medicare and Medicaid. And as a certified Medicare organization, we agree to adhere and comply with a certain set of regulations. We're subject to unannounced surveys to make sure that we're following those regulations. And I'm really happy to say that we've had a couple of our surveys in the last year, and we've been deficiency-free. So, it really speaks to the work that's being done every single day in our organization to make sure that we provide high-quality care to the people in our community.
You mentioned the staff or the patient surveys and getting feedback from patients. So you do that through a formal survey process, but it's also probably important to note that you welcome those calls, good or bad, and letters.
Absolutely.
Because you want to know and address issues at hand or celebrate the good that you're doing when
Absolutely.
people praise
It's
you.
a wonderful way for us to